experts. Welcome to the Ask the Experts show with local celebrity hosts Steve-O and Renee. Sit back each week while Steve-O and Renee educate you with live in-studio experts, such as lawyers, doctors, home improvement, and financial experts in their field. Call in and have your questions answered each week at 888-565-1470. Now, here is Steve-O and Renee with today's expert in their field.
Good afternoon and welcome to another Ask the Experts, where we bring you every Monday and Friday the experts, the creme de la creme in the areas of health, legal, financial, and home improvement. I'm Steve-O, and I'm here with my beautiful co-host, Renee.
What's happening, Steve-O?
Don't get too excited.
That's me getting excited.
You know, today's show is going to be a little crazy. I can already tell.
I feel the vibe
This is
here.
not going to be our normal MorseLife show, which is good.
Yes.
It could be bad. We might not even have a client after this. Anyway, we've got two great shows for you today. And Renee and I are constantly striving to bring the best of the best. And when it comes to a company like MorseLife, there is no better. Does that make sense? There is
no better, yes.
Well,
they are the best.
Since I'm from Dallas, I can go, they ain't no more better.
Okay.
So,
but you have two New Yorkers here, so.
Oh, God. Hey, in the second half hour, we've got our friend Barry Fowler, the owner of Taxation Solutions, on with us. Hey, so let's get started.
So let's introduce our first guest, Dr. Allen Sadowski, who has many roles at MorseLife. And if you'd like to watch our show live or go back later on to review today's show, go to www.morselife.org. So you head Palm Beach PACE, and that's a program that's all-inclusive care for the elderly. So tell everybody about that program.
Well, Palm Beach PACE is new to Palm Beach County, but let me start by saying how delighted I am to be here. And
he's buttering us up.
Thank you. Can I tell you, we're thrilled to have you as well.
Thank you for making me feel welcome. And
you are so welcome.
Palm Beach PACE is a part of a division in MorseLife called MorseLife Home Care. And the whole idea of PACE is not exactly new. PACE is an acronym, and it stands for Program All-Inclusive Care for the Elderly. And it actually started in 1976 in Chinatown in a community in San Francisco, and it was the On-Lock Services. And the thing about PACE, though, is that in the last decade, the growth of PACE has doubled nationally. So now there are about 106 PACE providers throughout the country in 32 states. And MorseLife applied to become a PACE. It's a very elaborate process to become certified to be a PACE program. We'll talk about that in a moment. But we really have the exclusive for this county. And what this program does for Palm Beach County. So, right. So what this program does, which is really exciting, is it takes a group of seniors, and predominantly these are people who have Medicare plus Medicaid. And they have to be nursing home eligible, which means, by definition, they're fairly frail. I did some statistics today, and they have to be at least 55 years or older. But our average age is about 81. And so the government, in its wisdom, is saying, if someone meets the criteria to be in a nursing home, because you can't just walk into a nursing home, you have to show that you've
evaluation.
You've had an evaluation. You have to show deficits in two areas of activities of daily living. And so if you meet the criteria for being in a nursing home, the government is saying, essentially, we will pay this provider to care for you at home and meet all of your needs rather than to put them in an institutional care. And that means that if someone gets sick and needs to go to the hospital, we pay for it. If someone needs to go to a nursing home, we pay for it. We also pay for all their medications. So
that's a wonderful program to be part of.
It's a wonderful program, and essentially what it means is that we are absolutely 100% invested on their well-being and avoiding institutional care. So, you know, we will do enormous kinds of things to help people stay in their home. We'll add,
where they feel secure.
Which
is so great. Well, you don't want to go to a nursing home.
Well, you know,
want to stay at home.
So basically, you send in home care. Is that what you do?
We'll send in home care. We'll send in nurses. Look, I happen to be privileged. I work for MorseLife. I've been there 15 years. It's a 5-star Gold Seal facility. They don't come any better, as you said in the
Yes,
intro.
absolutely.
It's a spectacular place. Even so, most people prefer to live at home as long as they possibly can with maximum independence and dignity. Because everything that we do at Morse is we're making it home-like. But we realize most people, all things being equal, there are lots of exceptions, prefer to be at home.
Absolutely.
So we will bring the care to them. We've seen people call late at night having an anxiety attack, and we've sent our staff out there. We've had people essentially talk a client off the roof, and all in an effort to keep people from going to the emergency room. Because when a senior citizen who's frail, who meets the criteria for nursing home, we have people as old as 100 in PACE as well. When they go into a hospital, it often is disastrous. Hospitals are going to find things. They're going to keep them for a while. They could easily get lost in the shuffle. I mean, it's not uncommon, for example, for a very frail senior to go to a hospital and they're get worse. They're trying to figure out what's wrong with this person. So during the interim of all these tests that they perform on someone, they're poking them and they're waking them to give them their sleeping pill and all that stuff. So they might bring in a tray of food and say, here's lunch, and walk away. And the person maybe has a little dementia, can't make all their needs known. They can't feed themselves. So we have seen people, there's actually a diagnosis, hospital-induced psychosis. People go into the hospital and come out sicker. So our goal when when someone goes into the hospital and they're really that vulnerable, we do everything we can to get them out. We are calling, we are camping on the front door. We want to get them out as soon as possible because it's often not a good experience to be in an acute care setting.
So you're on call 24 hours?
We have a rotating call schedule of staff. I mean, PACE started out in November of 2013. So what it is a 3-way contract between our organization, the Center for Medicare and Medicaid, which is called CMS, and the Agency for Healthcare, which is called ACA. The application weighed in at about 13 pounds, give or take a little bit. The certification process took months. It's extremely tedious, enormously regulated, because what we're doing is we're telling people, like I said earlier, the majority have Medicare and Medicaid. We're saying we will be your provider. We essentially become an HMO for seniors. So they're giving up their Medicare rights and their Medicaid rights.
Wow.
So we have to prove that they understood all of this, that we're not in any way providing any stress or duress for them to sign these benefits. But it's curious because, not to me, because I've seen PACE programs all over the country, wherever PACE has been, satisfaction's through the roof.
How do you apply for something like that?
It's a very complicated process. You decide as an organization that you want to do it. In our case, we hired an outside consultant to do a feasibility study. PACE can provide 32 services. We were already providing 31 of the 32. So the consultant said, if MorseLife can't do a PACE, we don't know who can do a PACE. So the only service we weren't providing was acute care hospitalization. So we developed contracts with some of the providers to do that. And then the Agency for Healthcare and the Center for Medicare, they supervise every step along the way. We have monthly monitoring calls where, they're on the phone with us. They want to know if someone has disenrolled, why. They want to know if someone who's fallen, what's the reason. If there's a grievance, if someone is angry because the bus was 5 minutes late, everything is documented. The detail that we have to provide is exquisite. But wherever PACE has been, satisfaction has been through the roof. And think about that. Many of these people that we're providing care for are people who are financially limited. They see their doctor in a clinic. They've never had anyone be this interested in them. Every morning we gather in the 8:15 in the morning, and we talk about all the clients in the program. And at that meeting, by law, there's a dietitian, a physician, a nurse, social workers, a transportation coordinator, a physical therapist, occupational therapist, and a recreational therapist. And so PACE is a medical program, but it's also a social model. I can't tell you how many times people call and they want to know about PACE for their mother, their wife, whatever, and they say, except my mother, she doesn't like to be around other people. PACE might be great, it's good for the medicines, because it doesn't cost people anything, usually out of pocket. Typically, there's no cost to them. So
which is truly amazing.
Yeah, so they're getting all this comprehensive care, and I'll talk about why this is true, Renee, in a minute. But my mom doesn't want to be around other people. And then within 2 weeks, they want to come every day. The food here is better than I get at home.
Exactly.
And the reason that it doesn't cost is because, again, the structure of PACE is it costs less for the government to pay for someone to be cared for at home than in a nursing home. And so before I came to Morse, I was actually in the clinical trials arena. My brother is a neurologist. We worked together. And the end point of a lot of the studies on the newest breakthrough drugs is days spent in nursing homes. And so if we can do something to reduce the time spent in a nursing home, as nice as Morse is, we're being effective. And so what we do is bring the services to them. And the government says it's more effective. It's more humane.
This sounds too good to be true.
It does sound too good to be true.
So how many people do you have in the program?
Well, we are presently, as best we can
Because you're
determine.
the exclusive.
Yes, you apply either for the whole county or by zip code. So we applied for all the zip codes in the county except for Belglade and Pahokee, only because it's far away and there's rules about how long they can be on the bus, and we didn't think we could meet that rule. So as best we can determine, we're the quickest growing PACE program in the country. We started opening enrollment in November of 2013. We now have 122 people in our program. And you get awarded slots through the Florida State Legislature. So MorseLife keeps an active presence in terms of working with the state legislature, letting them know what we need. And we have been certified to have up to 450 slots.
That was my next question.
So we're growing. We've already identified our second site, and we're going to begin construction within the next 30 days. That's an estimate on modifying the site for our second site, which will be more accessible to the folks in South County. And your next question, I bet, is where is this site going to be? And I'm so delighted you asked me that
And
question.
we'd love to hear it.
We're going to be...
He doesn't need us.
Just trying to show me.
We're locating ourselves in a temple, in a Reformed temple.
Really?
On Atlantic Boulevard, yes. And the reason for it is most temples, and I know because I'm very involved with my own temple, are looking for additional revenue sources.
Exactly.
And they're not busy during the day.
Right.
So the temple's sitting there and they have to pay rent, but during the day there's very few people there. And so because of its location, because of the geographical location and the physical structure of this temple, and because we are so associated particularly with the Jewish community, although PACE serves everyone, I want to make that clear.
So does MorseLife.
As does MorseLife. It was just an absolute win-win. So we're so excited. We're working with the temple hierarchy. We have MorseLife, by the way. One of the most unique things about MorseLife is that about, I hope I get the time frame right, about 2 years ago, we hired our own architect. So we have an in-house architect because we are so progressive in terms of where we think we're going to be in the next 5 to 10 years. We know we're going to be doing construction. So we're dealing with an architectural firm. We liked the representative they had, so we hired this person. So we have our own in-house architect.
That doesn't surprise me.
Do you guys do anything small?
Have you met Keith?
Yes. He's our
Really nice guy.
He was our first guest.
Yes.
Well, so, no. I also think that, MorseLife is a not-for-profit organization, and really it's like a series of 10 companies. But we run it like a business, even though it's not-for-profit, because you have to. And if you're not able to meet your expenses, you're not able to serve the mission of the organization. And we have, I'm really blessed to be part of an administrative team where people do think about the future. We have a strategic plan every year. We are familiar with the plan. All of the executive team members know what is expected in the next year and the year behind that. We have financial projections up through and including the year 2022, 23.
Wow.
Very few for-profit organizations do that. So we know where we're going. You know, I guess it was Wayne Gretzky, the hockey player, said, skate to where the puck's gonna be, not where it's been. And so we know that we're, very fortunate to be in a senior market that is expanding rapidly. The anticipated growth of home and community-based services approaches 840% by the year 2030. And PACE sits in this division called MorseLife Home Care. So it's not just PACE, it's private home care and Medicare home care and all these care management programs. And we're trying to position MorseLife to be in the position to serve this explosion of frail seniors that we're going to see in South Florida. And we have to be ready.
Yes, we have to go to the commercial
we've got
break.
to go to commercial.
Yes.
When we come back, listen, people are probably, how do I get started? So let's talk about the ideal candidate when we come back. We'll be back with more MorseLife. Dr. Allen Sadowski. We'll be back in a minute.
MorseLife is a nationally recognized provider of elder care and support services for seniors and their families in Palm Beach County. Located on the expansive Marilyn and Stanley M. Katz Seniors Campus in West Palm Beach. MorseLife is dedicated to enhancing quality of life for older adults through a full range of services. MorseLife provides long-term care, state-of-the-art short-term rehabilitation, luxury independent and assisted living, memory care, and home health services. MorseLife is also the exclusive Palm Beach County affiliate for PACE, the national program of all-inclusive care for the elderly. MorseLife has been awarded the Governor's Gold Seal of Excellence and is a 5-star nursing facility committed to continuous research and training that consistently delivers enlightened senior care. MorseLife also offers concierge care for clients seeking an enhanced level of private home care. For more information or a tour of the campus, please call 561-471-5111 or visit www.morselife.org.
No.
And we're back. We could just talk about this for the next 2 days. Because I know there's people out there who've got parents, elderly parents, and everybody wants their parents to be
well taken care of.
And Renee and I have talked about this. There's so many more women working now. And women usually, the daughters usually took care of the parents. But now that they're working now, they don't have the time to do that. So they want to get them in a special place. And I want to ask you, what are some of the other hats you wear at MorseLife?
Well, we have a mission-driven arm of the home and community-based program called Kramer Senior Services.
Which is what?
Kramer Senior Services includes programs like Just Checking. And Just Checking is it's the MorseLife Geriatric Care Management. And it is overwhelming. Look, I've lived in this community for almost 30 years. I have a brother who's a physician. I mentioned that. When my own mother was ill, navigating the system is not simple. It's not nearly as sophisticated as the Northeast. It's at best a fractured system. And so I call the folks who work in geriatric care management at Just Checking, the Morse Geriatric Care Management Program, the dot connectors. These are the ultimate dot connectors. They know, you can give someone a referral. If you tell a senior, I got a great place for you to call, 99 times out of 100, they're not going to make the call.
Wow.
You have to make the call. You have to say, is it okay for me to make the call? I make the call, and you connect one person to another. But also, you can give someone a directory, and it says, well, call this agency or call this provider. But you really need to call, Shirley at this agency because she knows where everyone is. And so it's really knowing the community, knowing the landscape, knowing, the pitfalls. There are some agencies that are more effective than others. There are some that do a particularly good job depending on what individual's culture is or their age or where they're located in the county. So knowing the community is critical. We have a program called Meals on Wheels, and Meals on Wheels was it's sort of this whole sexy topic now that you deliver. A lot of the people, when they get to be a certain age, are no longer able to drive, which means they can't go shopping or they have difficulty preparing a meal. We provide over 50,000 meals prepared in our kitchen, overwhelmingly delivered by our volunteers. And now gas is down to $50 a barrel, but when gas was $120 a barrel and gas was $4.50, our volunteers were so dedicated that they would not give this up. I mean, this was like a sacred mission to them.
Nice.
And the volunteers would go into the home and say things like, you know, Mrs. X didn't look so well. You might want to go out and make a visit. So we could do that. Or the mail wasn't being picked up. Or the house didn't look, you know, well. It was in disarray. And so they become our eyes and ears. And so the more often we're out in the community, the more we're able to help and provide these services. Because it is the rare senior who is going to call and say, I know exactly what I need. Please help me with this service. Typically what happens, and the phone rings all day long, is someone calls and they start to cry. And they can't tell you what they need. All they know is that they need help.
Yes, and having family members
or family
getting
members,
involved.
right? And we see it all, Renee. We see family members who are extremely well-intentioned and want to know everything about their loved one and are delighted when we give them information. And we see family members who live 5 miles away who really are uninvolved and haven't seen mom in a long time, and are looking for some sort of a financial assistance. So we see it all. And again, one of the beautiful things about MorseLife is that we are able to see a whole range of people. People who want a concierge service at the highest level, and people who really have very limited resources. It's not unusual, though. We'll see a 98-year-old caring for a 99-year-old, and we'll talk about the services, and they'll say, well, that's nice, but I have some CDs, but I'm saving for a rainy day. And it's pouring outside. And so, depending on the individual who's receiving services, we have to make it okay for them. It's okay to need some help. It's okay if we supplement it a little bit.
Right. And the nice thing about MorseLife also that we have to mention is the fact that you could start out with home care, being in your home, then move on to assisted living, and then go into a nursing home.
Right,
so
and that's
which
beautiful.
Is wonderful.
Because, the design, and, again, I give the administrative team and Mr. Myers a lot of credit in that you really don't want to, as the adult child, have to make 20 decisions. I have to go here for care management, I have to go here for meals, I have to go here for placement issues.
Right, it's very stressful.
Right, so you want to have one service, and look, in the rare event that we're not able to provide the service, we're going to at least find someone who can. But there's an excellent chance, there's probably 19 portals to get into MorseLife, all the way from our honors program where people, have like an identification card, and they come to our events and they get like a coupon book at a discount, and they become part of the MorseLife family. So, which is important.
Good family to be part of.
It's a good family to be part of, and you don't want there to be a lot of stigma. We've heard these stories. Oh, my wife or my mother said I could never put her in a long-term care, or euphemism for a nursing home. And if you become part of the family, you've already had care management, you're getting meals, you're familiar with adult daycare, you've been to the short-term rehab. When the time comes to make these difficult decisions...
Does that grandfather you in?
Well, it helps,
yes.
And you already know the players. Oftentimes...
We should start now.
People wait too long. I have room for. I'm not so sure.
You've got to give your website, because I know there's so many people out there going,
for PACE,
okay,
yes.
So what do we do? How do we...
you can get to the PACE site by just going to morselife.org, and there's a PACE tab, and you can learn all there is to learn about PACE. I can have them call our director at PACE, which is I won't even.
And this is not at 2:00 in the morning.
I will not ask you to spell her name because it's a long name. But her first name is Paola, Paola, and she's at 561-868-2991. And our staff is. One of the things that's been real gratifying to me is we've really increased our enrollment staff. We're the quickest growing PACE program in the country. And we're not doing a ton of marketing. our biggest referral source is word of mouth.
Word of mouth.
And so what we've really added is our enrollment staff, because to get people to be enrolled, it could take 40 people. It's a complicated process. And so we've added staff to help assist people in that journey.
You have room at the house for more.
We have room at the house for more, and the way PACE works is we get interest. As soon as there's interest, we work with family members to answer all their questions, because they have a ton of questions. And then the enrollment is at the beginning of the month. So we have, we enroll, it could be 7 people, could be 12 people, could be 15 people, and they all get enrolled starting the first of the month. And during that time, everybody on the interdisciplinary team, we call that the IDT team, sees them. And we see them in their home. So, for example, if someone is a fall risk and our home care coordinator goes home and sees that, the path from the bathroom to the shower is marble and slippery, and there's no grab bar, and maybe they could use a raised toilet seat, they'll make those recommendations.
That's amazing.
And then
that really is.
Well, but when you think about that, that's corporate self-interest as well, because God forbid someone falls on the floor and breaks a hip, in which case that typically sets a cascade of events.
Yes.
We're preventing a hospitalization.
Yes.
And I talked about that earlier. These hospitalizations can be a disaster for our population.
What we've got to do, we've got to talk to MorseLife. We've got to get Dr. Sadowsky back in. We have got so much more. We wanted to get into about the music for the elderly.
Music and memory program.
We could talk about that too.
So,
I know,
we've only got
limited
like 2
on time.
minutes left.
We have so many things to talk about.
We had a lot of things to talk about today, which we've got to get you back in to talk, because there's so many more important things we want to get out there.
Well, I'd be delighted to come back whenever you want me to.
Great guest.
But the music, it doesn't matter what the intervention is. It could be music, it could be food, it could be recreational therapy, it could be anything. It is our job to find out, that button that helps people to connect. And some people do it with music, some people do it with writing, some people do it with cooking or exercise. And so by having a team approach, or looking at a person holistically and all the different parts, and people talk in the clinical world about interdisciplinary teams. And I've witnessed a lot of interdisciplinary teams, and people talk, and then the physician says, that's very interesting, this is what we're going to do. And our physician, who has been a PACE director for 8 years before he came to us for the last 2 years, is very, very interested in all the team members, and he listens, and he's very passionate about hearing from all the different disciplines. Because if you've met one person in a PACE program, you've met one person in a PACE program. Everybody is unique, has different needs, and the art is to find out the best way to unlock whatever it is we can do to bring out the best in that client.
Well, we've just been given the finger.
Yes.
We know what that means. Oops.
Why don't you give the phone number out one more time?
The phone number for PACE is 561-868-2991. And the general phone number for MorseLife is 561-471-5111.
Perfect.
And if you call that number, they'll get to the right person.
Oh, I just got to tell you, I love your passion, bro.
Thank you.
Well, thank you so much for coming on
today. And I promise you, we're going to talk to MorseLife, and we're going to get Dr. Sadowsky back on the show again, hopefully next month. MorseLife is with us every month. We're going to go to break, and we come back, we've got our great friend Barry Fowler with
from Taxation Solutions.
We'll be right back.